I feel like that the mandible especially needs to be smooth. I haven't read about like what is the most common cause of a subperiosteal abscess. I don't know if there's a particular surgical technique that is a higher risk of that, but those things that come in and they blow up overnight and you got to do what you got to do to get to deal with that. But to me, smoothing off those little bony fragments like you're talking about, maybe even sometimes if it's, let's say the tooth is real buccal and then the ramus and you've taken away a lot of buccal bone and it's really thin there, you know what I mean? And there's be like a little void. So what I'll do there,
Yeah.
if there's a void in the bone there and I can see the masseter, I'll just go ahead and this is just my tech. I don't know if this matters at all, but I will just take off a little bit of that and smooth it, extend my flat, get my Minnesota in there a little bit deeper and just smooth it off. And then it just gives me the ability to visualize. I don't want to get into the tendon, but I want to make sure that I've got everything smoothed over because those are, like you said, these little bony fragments. I think can be a nidus for something, even if they're not aggravating to the patient. I think they could be, an area where I don't know. It's just I feel like that the mandible especially needs to be smooth. We haven't talked about the maxilla. I think most of our stuff and the vast majority of our complications are on the or issues like you said the bony spicule issue drives
Mhm.
patients crazy on the lingual, the third molar or second molar regions.